Welcome to the rapid fire pharmacology round. I'll ask 7 important multiple choice questions. Pause the video, choose your answer, and then I'll explain it quickly. Let's begin. Question 1. Which drug is used as a first-line treatment for hypertension? A. Furosemide, B. Amlodipine, C. Digoxin, D. Propranolol. Pause and think. Correct answer B. Amlodipine. Explanation. Amlodipine is a calcium channel blocker and is commonly used as a first-line antihypertensive drug. It relaxes blood vessels and lowers blood pressure effectively. Question 2. Which drug is an opioid analgesic? A. Paracetamol, B. Ibuprofen, C. Morphine, D. Aspirin. Correct answer C. Morphine. Explanation. Morphine is a strong opioid analgesic used for severe pain. The others are non-opioid analgesics. Question 3. Which antibiotic inhibits bacterial cell wall synthesis? A. Tetracycline, B. Ciprofloxacin, C. Penicillin, D. Erythromycin. Correct answer C. Penicillin. Explanation. Penicillin blocks cell wall synthesis, leading to bacterial death. This makes it a bactericidal antibiotic. Question 4. Which drug is used as an antidote for opioid poisoning? A. Atropine, B. Naloxone, C. Flumazenil, D. Activated charcoal. Correct answer B. Naloxone. Explanation. Naloxone is a pure opioid antagonist. It quickly reverses respiratory depression caused by opioid overdose. Question 5. Which drug is a proton pump inhibitor PPI? A. Ranitidine, B. Omeprazole, C. Metoclopramide, D. Ondansetron. Correct answer B. Omeprazole. Explanation. Omeprazole inhibits the HKAT-PACE pump in the stomach, reducing acid secretion, used in peptic ulcer disease and GERD. Question 6. Which drug is used in the treatment of bronchial asthma? A. Atenolol, B. Salbutamol, C. Propranolol, D. Digoxin. Correct answer B. Salbutamol. Explanation. Salbutamol is a beta agonist bronchodilator. It relaxes bronchial muscles and provides quick relief in asthma. Question 7. Which antidiabetic drug belongs to the biguanide class? A. Insulin, B. Glibenclamide, C. Metformin, D. Pioglitazone. Correct answer C. Metformin. Explanation. Metformin is a biguanide and the first-line drug for type 2 diabetes. It reduces glucose production and improves insulin sensitivity. Conclusion. That's the end of our rapid-fire pharmacology round. If you scored 5 or more, you're doing great. Like, share, and subscribe for daily MCQs, exam boosters, and pharmacist marathon videos.